Hello there. Welcome to another episode of Rare Diseases, a podcast run by Rare Disease Review Western, a student-run non-for-profit organization that aims to translate complex rare disease research into easy-to-digest articles and that supports and advocates for rare disease patients and caregivers. Today, we welcome Alice, who is heavily involved in advocacy efforts for Wilson disease, a rare disorder that causes a buildup of copper throughout the body, particularly in the liver, brain, and eyes. Her family has been directly affected by this disease, so it is a topic that hits close to home. With a background in corporate communications, Alice has applied her skills and experience to support the work done by rare disease organizations such as Wilson Disease Association and the Canadian Organization for Rare Disorders, also known as CORD. Alice also serves as a patient partner at the University Health Network in Toronto, where she uses her caregiver perspective to provide advice on a variety of projects in hopes to improve the quality of healthcare that patients receive in Ontario. Today, we will speak with Alice about her personal experiences with rare disease and all the advocacy work she has been involved in. Alice, thank you so much for taking the time to speak with us today, and it's a pleasure to have you on the podcast.
Well, thank you so much. I'm thrilled to be here and thanks for the opportunity to talk about Wilson disease.
Of course. Just to get started, our first question for you is, would you be able to tell us a little bit about yourself?
Sure. So I live in Toronto. About a year and a half ago, I retired from a 30 plus career in corporate communications. Had never worked in healthcare, did communications for banks, governments, and boutique PR firms. Was all set for retirement, was looking forward to a life of pickleball and bridge and travel, and then the universe had other plans.
Thank you so much for taking the time to, share a little bit about, the story and how you got to this point. Our second question for you now is, so you've openly shared about having Wilson disease in your immediate family. So we were wondering if you could tell us more about your family's journey with Wilson's disease from when you first encountered the diagnosis to how it continues to play a role in your life today.
Sure. So it's been, I guess, about a year and a half, and I'll try to be brief. But basically, my 19-year-old daughter at the time came home from university at Queens in Kingston, came home for winter break, December 2022, and just felt awful, nauseous, bloating, extreme fatigue. I was like, oh, well, it's probably just burnout from exams. You've been burning the midnight oil studying exams. But she was ended up with severe ascites in her abdomen. So we went to the family doctor, did some blood work, did an ultrasound. The family doctor said, wow, her liver enzymes are quite high for somebody her age who's otherwise healthy. And she has some fluid retention. So, let's keep an eye on it and monitor. Over the holidays, it got worse. She slept, a ridiculous amount, like 20 hours a day. I said, I really think you need to stay home because something's going on here that we can't figure out. She wanted to go back to school. So she did go back, and I said, please, please go to emergency if this gets worse because something serious is going on here. But we didn't think Wilson disease. We'd never heard of Wilson disease. I thought irritable bowel syndrome, maybe it's her appendix. I thought anything but Wilson disease because I'd never heard of Wilson disease. She went to emergency in Kingston, and the stars must have been aligned because they admitted her Thursday night, and Saturday afternoon they had diagnosed her with Wilson disease. We felt completely blindsided. I remember the doctor saying, your daughter has Wilson disease. And we said, well, what is that? They explained what it is, and that my husband and I were no doubt carriers of this, defective gene, and we had passed it on to our daughter. So we were all in shock. My daughter, quite frankly, enjoyed pretty good health up to this experience till age 19. So, my second question after what is Wilson disease was, well, how do we treat it? And they said there is a treatment program. However, your daughter's liver is so ravaged, she's basically at end stage liver disease, and she requires an emergency liver transplant. So I felt like I was in a boxing ring and you get hit and then you just keep getting hit. we were in a state of shock. So, thankfully the system worked. Kingston General was in close contact with Toronto General, the transplant team there. Tons of work behind the scenes, no doubt. Kira and I took an ambulance down the 401 from Kingston to Toronto. And within 10 days of being diagnosed, she had a new liver, which is when I tell people that, they're in shock because, as you may know, people wait for organ transplants for months or years. And sadly, some people don't get the transplant in time. So that's basically how severe her health was, that she was literally at death's door. I mean, I remember the doctor saying it's the only life-saving option. So she had the transplant in January 2023. So it's almost coming up on about a year and a half. She's doing great. She's back at school. Feels good. She's taking anti-rejection meds, which she will for the rest of her life. But she seems to like the liver. It seems to like her. So we're very, very happy. And of course, thankful to the anonymous donor. It was a deceased donor, but so thankful to that family who did something extraordinary at a time when they were probably grieving, as much as we were grieving this news. Because Wilson disease is genetic, we were advised to test any other siblings. I have a son as well. Unfortunately, he too has Wilson disease. As you may know, it's only a 25% chance. Even though my husband and I are both carriers, I have a working gene and a non-working gene. My husband's the same, which is why we don't have the disease, even though we're carriers. We unfortunately passed Wilson disease to our son as well. He's 24. His liver is not as damaged as his sister's, so he is undergoing like a chelating agent. It's called trientine, which basically draws out the excess copper. It binds with the copper, and then you just excrete it, via your digestive tract. It seems to be working. It's just as the buildup of copper is so slow, the excretion of copper has to be equally slow. So it seems to be working, which is great. Only about 5 to 10% of people with Wilson disease do require a transplant. So I'm very hopeful that my son does not require a transplant, that the meds will work. And then if he's actually at a point where they feel like the copper's at a good kind of maintenance level, because as you know, our system does need some copper for health, he can actually potentially take zinc, like a medical grade zinc, which blocks the absorption. So it doesn't excrete the excess, it actually blocks it. He also follows a low copper diet. There's copper in shellfish, chocolate, mushrooms. So he has to follow a low copper diet. So yeah, from not knowing even the word, I feel like I'm becoming a bit of an expert on Wilson disease within, I guess a year and a half.
Yeah, thank you so much, Alice, for sharing that story with us. I can imagine it must have been really shocking to, one day have your daughter be completely okay and then the next needing that emergency liver transplant and, not even knowing what Wilson disease was. But I am really thankful to you for sharing that story with us today. And I'm really glad that your daughter is also doing well. And I hope that, your son is all right too. And kind of with that story that you've shared with us, my next question for you would be from the perspective of a caregiver, what would you say has been the most challenging part when supporting your children through a rare disease diagnosis?
It is challenging. I've always kind of been their caregiver as their mom, but to what I presume were two healthy kids. So organizing the dentist appointments and the doctor's appointments, and eat your fruits and veggies and drink your water and all that stuff. The challenge I had is, so they're now 20 and 24. They're adults, although young adults. So from a legal medical point of view, they are in charge. They're the adult. So often if I call the doctor, they're like, I really am not supposed to be talking to you because your child is over 18. So I find that hard because of course I worry so much. Are you taking the meds? What did the doctor say? So I feel like I'm kind of parenting from the sidelines, and I think maybe it's how you parent anybody in their 20s, let alone two children that who have, health conditions. I'm more like a consultant or a coach. I have to take my kind of cue from them. And really, I just try to be supportive and sort of say, hey, the healthcare system can be pretty complex. And when I go to an appointment with my doctor, I always like to have another person come just to ensure, did I ask the right questions? Did you hear what I heard? So they are in charge. It's their own body, their own health. They're adults, but I try to say I'm just here sort of as a friendly second set of ears and eyes and a partner to help you. Understanding that the system can be complex, particularly when it does come to rare diseases.
Yeah, you bring up a great point about kind of having them take, the driver's seat and navigating this, this health condition on their own, but also you being there to support them because I feel like no matter how old you get, navigating a difficult situation, whether it be a healthcare concern or something else, it's always great to kind of have that support system behind you. And from that, my follow-up question actually would be, what would be one piece of advice that you would like to give other caregivers who are also navigating taking care of someone or being supportive to someone who is currently new to their diagnosis with a rare disease?
Yeah, I mean, I think it's not an easy thing to navigate. It's a bit of a dance. And I talked to other people who were parents of children with rare diseases or transplants, children, young adults. And I think the advice I would say is obviously support them, help them, but don't be consumed by it. There still has to be room for joy, enjoyment of simple things. I was, quite frankly, so worried and anxiety ridden about this transplant and Wilson disease and what does it mean. I think I was driving them crazy. Did you take your meds? Are you drinking enough water? It's important to drink lots of water when you're on this heavy medication. Are you eating well? Are you sleeping? My daughter is on immune compromised medication, anti-rejection meds. So, she wants to go to concerts and out. I'm like, well, wear a mask. And that doesn't go over well. So I find I had to take my worry and almost park it and take again my cue from them and realize, yes, support them, but also just don't let don't let it all be about the disease and the transplant. I remember they said to me, I think a couple months into this, like, where did fun mom go? She doesn't seem to exist anymore. It's just worry, angst ridden mom, you know? Like, I think for them, this is their new normal. My son has Wilson disease, my daughter has a liver transplant. I have neither. So I find I'm so anxious about it. They actually seem to be rolling with it more. So I'm having to take my cue from them. So I think it's like support, but don't let it be consumed. And there has to be room for joy and fun.
Well, thank you so much for that answer, Alice. Yeah, it's understandable that I guess with a rare disease diagnosis, there's a lot of stress that comes with it. And I guess also a really great thing about the rare disease community in general is that it is a community. So even if, there is stress and anxiety, you do have the opportunity to reach out to other people, who have Wilson disease and you have I guess a supportive network who can help you out with that sort of,
Hmm.
I guess that stress and anxiety and sort of navigating that situation. So yeah, it again it makes sense sort of that approach of, I guess there is stress, but being able to manage it, but then giving, your children the space to continue growing as people and to
Hmm.
navigate that health situation the way that they want, that they see fit to steer it.
Hmm. No, it's so yeah, definitely.
So, I guess moving on to the next question. When it comes to rare diseases, like Wilson disease, they often don't receive enough attention within the healthcare system. In your opinion, what are some of the biggest gaps in the healthcare system when it comes to rare disease? And what steps do you think need to be taken to reduce those gaps?
So I think there's huge gaps. I try to be a positive kind of solution-oriented person, but I think, you have to admit the challenges. I think there's huge gaps. I mean, the name itself, rare disease, implies that it doesn't happen often. Oh, that's rare. That doesn't happen. The reason there's that definition is it has to affect fewer than 1 in 2,000 people. Wilson disease affects about 1 in 30,000 people. So I think that's part of it is that, I think the conventional thinking is it's rare. The reality is it actually affects 1 in 12 or 3 million Canadians. There are anywhere from 7 to 10,000 rare diseases. So yes, on an individual basis by disease, perhaps it's rare in that it is 1 in 2,000, but collectively, 3 million Canadians or 1 in 12 have rare diseases. The other thing that's interesting is that the great many rare diseases are genetic, like Wilson disease. So it affects children at birth. It affects babies. My 2 children came into this world with Wilson disease. It by and large affects, children, and sadly, many won't see their 5th birthday because even though there's, 7 to 10,000 rare diseases, it's my understanding only about 5% have treatment. So there's great unknowns about rare diseases and the 7 to 10,000 that aren't there. Usually they're very medically complex patients. They don't present with a cookie cutter approach like, oh, okay, this looks like diabetes or we saw the tumor, so this has to be cancer here. Wilson disease, for instance, can present with psychiatric, neurological, or liver symptoms, or a combination of the three. So it depends on the age, the stage, the disease progression. They're all complex diseases, and I think the system, really there isn't the resources or the time or the expertise to truly understand these rare diseases. So you often hear about people who are bounced from specialist to specialist, and they're on this what they call a diagnostic odyssey, where it can take 5 to 7 years to get a diagnosis, if they even get one at all. There's even ultra rare diseases that might affect a handful of people around the world. So it's a very small patient population, which is why I don't think it gets the focus of research dollars, focus in the healthcare system, or like treatment. So there are lots of challenges. I mean, I think the more I'm learning through my involvement with Wilson Disease Association, with Canadian Organization of Rare Disorders, I feel like we're stepping out of the shadows and we're kind of having a bit of a moment. So there are some exciting things happening where I think rare diseases will get more attention and hopefully innovation in treatment and care.
Yeah, you made a really great point when you talked about the numbers of how, even though it is called a rare disease, a lot of people still are affected by it when you look at the community as a whole, because all these people have different rare diseases. And it makes sense that sometimes it might be difficult to diagnose given the complexity of these rare diseases, but it is still really important given the number of people who are affected to kind of go in that direction and talk more about it and raise more awareness so that we can, take a step in the right direction in reducing some of these gaps that we see in the healthcare system when it comes to rare disease. And you mentioned, Alice, that there are some exciting things coming up in terms of rare diseases and, steps in the right direction. So our next question is actually kind of focusing on that. You mentioned CORD. So organizations like CORD play a big role in advocating for health policies and a health system that supports individuals with rare diseases. So our question for you is, as a board member of CORD, could you tell us about some of the advocacy efforts that you've been involved in personally, and what goals does the organization have that they're currently working on?
So I'm a relatively new member to board Accord. I guess I've been on the board probably less than a year. So any of these initiatives I'm talking about, I cannot take any credit for them. I'm sort of late to the party. But it's an amazing organization. It's like a national umbrella of the rare disease community. Our fearless CEO, Durhane, is incredible. So, I'm happy to be part of sort of, I think, this exciting time in the rare disease community in Canada. But I will tell you about some of the initiatives. But again, I wish I could take credit, but I'm glad to be part of it. So there's a Canadian Rare Disease Drug Strategy. I guess it was March 2023. The Canadian government announced about $1.4 billion for a Canadian rare disease drug strategy. This would, have to happen through bilateral agreements with provinces and territories. It's been very slow moving. That was March 2023. There's sort of early action, but we don't have these like robust bilateral agreements where we have funding for innovative drugs or we have a national drug strategy. But it does exist on paper, and I think CORD is very actively involved in trying to get movement on that. Another initiative that CORD's very excited about is newborn screening. So right now we do not have a national strategy for newborn screening. Each province and territory has their own screening panel. Different conditions are tested with newborns within, I guess, 1 to 2 days of birth. You get that, those poor little babies, unfortunately, get that little heel prick where you take a blood spot. Personally, that's something that I'm very excited about. There's a doctor in Seattle, Dr. Hahn, who has developed a test for newborn screening for Wilson disease. So, I'm personally very excited about that possibility in that, we could test newborns to see if they have Wilson disease, and they could be so much more closely monitored and treated before the disease progressed. CORD is really involved in sort of developing a state-of-the-art newborn screening, testing strategy. The other thing, I had the good fortune to go to the conference in Ottawa, and this year it was February 29th, which is true. Rare Disease Day is always the last day of February because it's the rarest day of the year. This year it was February 29th, the leap year. So that was very exciting to be in Ottawa. We marched to Parliament Hill to make our voices heard. And that day, the Canadian Rare Disease Network was launched. So this is, just announced February, and the Canadian Rare Disease Network is sort of a loose coalition of clinicians, researchers, hospitals, industry partners, patient groups, really giving like a centralized voice to the rare disease community. So early days, but some exciting stuff where they can really focus on advancing, diagnoses, treatment, care, innovation, reimbursement for rare disease drugs, which are often very complex. So yeah, there's some exciting things happening right now. I feel like, and having that sort of centralized Canadian Rare Disease Network, is finally a place where the community can come together and share innovations and research and opportunities.
Thank you so much for your answer on that, Alice. Yeah, I mean, I've heard of a couple of these things from Cord in, I guess, in the past few years, especially with the National Drug Strategy.
Mhm.
And there was the Rare Disease Network that you mentioned that I never heard about before. So it's really exciting that all of these developments are coming up with rare diseases and through the advocacy efforts of Cord. I guess that kind of leads us into our next question. Another organization that you're involved in is the Wilson Disease Association, and they've shared new research advancements involving Wilson disease, touching on things like gene therapy as a potential treatment, as well as the development of newborn screening tests, which I believe you touched on with CORD already. So I guess from the perspective of the Wilson Disease Association, what impact do you foresee these advancements having on those diagnosed with Wilson disease? And do you believe that this research is adequately supported?
Yeah, so that to me, is another exciting time. Like I think with the, we're on the cusp of, everybody's talking about AI, artificial intelligence, and how is that going to change industries and how we work? And I think one area where it's very exciting is healthcare. Massive amounts of data that no one human, has the bandwidth or capacity to digest and analyze. So there's some really exciting things happening specifically to Wilson disease. Yeah, like gene therapy, there are two kind of niche pharma companies, Vivet Therapeutics out of France, Ultragenics out of California, that are actually have some gene therapy clinical trials on the go right now. So, this gets into the area of like gene therapy, gene editing, precision medicine. Basically, it's an IV infusion where you send a corrective copy of the gene to the liver. Essentially, my children, my son, he has a defective copy of that gene, which does not process copper. Hence, he gets a toxic buildup. But with gene therapy, you can send a corrective copy of the gene, which essentially it doesn't cure, but it does the job that the liver is not doing naturally. That to me is just so exciting. My son takes 2 pills in the morning, 2 in the evening to remove this copper. If he could do literally a one-time infusion he might have to do once a month, or maybe a couple months or once a year, where he can correct the gene. That's really exciting. And there are, as I said, there's 2 clinical trials on the go right now. Mentioned newborn screening. So, the other thing that we're really keen about, and I know Cord is as well, is patient registries. So, the challenge with rare diseases is that we really don't have good data. So even Wilson disease, people are saying, well, is it really 1 in 30,000? Because we don't have a database or a patient registry where we can, point to that conclusion. So Wilson Disease Association has funded a patient registry. There's about 200 patients. A lot of them are at US sites. There's some in Europe. And this is a multi-year project where we're looking at these patients, gathering data to understand, the disease progression, the disease presentation. And this will influence, research and innovation. So I think that's a real heavy area of focus for other rare diseases as well, is that if we can start creating true patient registries and gathering data, we can understand the patient population so much better. And then that can influence research, pharma interest, innovation, government interest as well. You asked about, do I think it's well researched? I know on behalf of Wilson disease, we're very thankful for these niche pharmas that have stepped up and are focusing on the rare disease space. Ultragenics, Vivet. There's another one called Orphalon that are very much involved with Wilson disease, and we're so thankful for that, because unfortunately, the larger players, the more conventional pharma players, maybe there is some work being done, but it's not as exciting as sort of these developments. Like, just to give you a bit of context, there's 2 medications you can take to extract the copper. One is called penicillamine. It was first discovered in the 1950s by a British doctor. It's still being used. So, that's medication that was prescribed 70 years ago. Trientine is similar. I think it was first prescribed in the late 60s. So the community is so anxious for new innovation and new treatment options. You can imagine penicillamine, taking something that was discovered 70 years ago. There are sort of some serious side effects. Maybe it's not effective. So I feel again like we're on a cusp with AI and gene editing, precision medicine. It's an exciting time, and I think hopefully we'll see lots of progress with more innovative treatment options for rare diseases.
Yeah, thank you so much for giving us a rundown of kind of what's been happening behind the scenes with these treatments. You mentioned the patient registries, and that's something that I've heard before too, and it's really great that we kind of are beginning to develop those patient registries to kind of, get a leg up in the research that is being done. And the next question I would have for you is, given everything that you've been involved in, we found it very inspiring. And our question would be, what advice would you give to others who are also interested in getting involved with rare disease advocacy? And do you have any tips that you could give to help them get started?
Yeah, I found it very intimidating. I never worked in healthcare. I really didn't understand healthcare. I would go to my doctor once a year, and she'd say, let's do test blood work. I never asked questions. I'm like, okay, do what you got to do. Um, so I felt very intimidated by entering this space because I thought I'm not in the medical community. But the more I learn, the medical community, the healthcare system wants patient input. So the advice I would say is, find your voice, figure out your interests and strengths, and dive in. Start small, say yes to opportunities, and realize you will grow your knowledge as you go, but don't be afraid to dive in. I mean, I've worked in communications, and I can tell you right now, the work I'm doing, it's the most passionate work I've done in my entire career because it's so personal. It involves my children. Take that passion as your base and understand that the system does want your input. As you mentioned in the intro, I'm a patient volunteer with University Health Network, and I sit on, recruitment panels, different committees. They truly want your input because, as they say, you are the people we're serving, the patients and caregivers, families. So where to get started? I'm reading an amazing book. It's called Rebel Health, A Field Guide to the Patient-Led Revolution in Medical Care. It's by a woman named Susanna Fox. And it really is a how-to guide to tap into your power as a patient advocate. She does countless case studies of patient-led initiatives and organizations that have changed the system, that have helped to change the healthcare system. She talks about, the four types of advocates. There's seeker, networker, solver, champion. So it's a fantastic read. It's very empowering and inspiring. But to anybody out there who's impacted by rare diseases, whether it's your children or loved one or you yourself, you will obviously have passion because this is your life. So fuel that passion, find opportunities, and don't be afraid to ask questions and question the system and question where there can be improvements, because there can be. And I think people in the system know that, which is why they're reaching out to the patient voice. So there's a lot of exciting things happening, but that's kind of a great book if you want an inspiring read, how to get started.
Yeah, I mean, like as rare disease advocates, Anusha and I ourselves, to hear these words from you about, your journey as an advocate and yes, where you've drawn inspiration and what is fulfilling about your work, it certainly fills me with further renewed passion just seeing how other people tackle the advocacy work for rare disease. And so as we were talking, I kind of had a follow-up question pop up in my head.
Sure.
And yeah, so as you were talking about a lot of the things that, Court has been doing that's really exciting, things like the National Rare Disease Drug Strategy, Rare Disease Network, as well as the hopeful thing that the healthcare system wants patient input, for example. And I'm just wondering, how do all of these things inspiring hope within the rare disease community?
Oh, I think they're definitely inspiring hope. Again, people with Wilson disease are still taking a pill developed 70 years ago. Now we're potentially on the cusp of gene therapy, which is, an entirely new, innovative treatment option, which, could maybe ensure that people no longer have to take 4 or 6 pills a day. So I think there's tons of excitement. It's the early days, but I think that's what's exciting about it too, is that there's so much opportunity. Like, the Canadian Rare Disease Network is just announced, it's not February 29th. There's lots of opportunity. There's more research and potential funding on the table for the rare disease community. So I think there's a lot of exciting stuff. Yeah, I mean, I've worked and met so many people from different spaces, and it's just, I think part of it is sharing those stories, those personal stories, because those have the most impact. At the end of the day, we're talking about people and people's health and lives. So I think people are now, they're coming out of the shadows. They're not suffering in silence. They're realizing that, they have a voice and they have something to say. So it's very exciting times.
Yeah, thank you so much for your answer on that, Alice. As I was wondering, is there anything else that you would like to share with us and our audience today before we end our episode?
everybody's different. It's like that book. You're either a seeker, a networker, a solver, or a champion. But when I first learned about my kid's diagnosis, I felt so alone, and it's a very sad, frightful place to be. So whatever people are going through in their family, their friends, there is an amazing network of people out there who want to help. So develop. I think having a sense of community of like-minded people, develop that sense of community, and it'll ease the suffering and the grief and point to hopeful, positive things. So I think all the research learning I've done, I don't feel so afraid about Wilson disease as I did a year and a half ago, when my daughter almost died in the hospital. I'm much more hopeful. So I hope your listeners feel a sense of hope about what they can do and how they can contribute.
Those are really powerful words. And yeah, the way that connection can bring us all together, but then also alleviate those sort of negative emotions and then foster the hope, the positivity, the optimism, and just seeing the brighter side of things. I think
Mhm.
that's a really great way to approach it. And I appreciate you delivering that message to our listeners.
Well, thank you. Yeah, I've really enjoyed this conversation.
Yes, me and Anusha did as well. So, yeah, that's a wrap for today's podcast episode. We had such an insightful conversation with Alice about Wilson disease and all the amazing work that has been going on recently to support the rare disease community. Thank you so much, Alice, for taking the time today to chat with us.
Well, thank you both for the opportunity. As you can tell, I'm pretty passionate about this project. This work. So thanks so much for the opportunity.
Of course, Alice. Thank you so much for being here today. Stay tuned for our next episode by subscribing to the Rare Diseases Podcast YouTube channel or following Rare Diseases Podcast on Spotify. Check the description of this episode for the link to the Rare Disease Review Medical Journal and our social media pages. This is Rare Disease Review Western and Alice signing off.